This purpose for the video is to help study for the assessment of chest and lungs. Hi, I'm Shannon. I am your nurse today. Could you tell me what your name is? Mr. Sunshine? Great. And your date of birth? Perfect. So are you understanding that we're going to do a assessment of your chest and lungs today? Perfect. So what I'm going to need to have you do is you're going to take off your shirt, be disrobed from the neck down. So your shirt off, you can leave your pants on. I'm going to wash my hands and then we'll get started with the assessment. Great, so my hands are clean and we're going to go step by step through a very extensive chest and lung assessment. I'm going to start with the front of your chest and then we'll move to your back. But we're going to start at the chest and I'm going to look at your chest. Your chest seems symmetrical. Your skin color is normal for ethnicity. I see no pallor or cyanosis, no swelling noted. Your skin is dry, warm to touch. Your skin is smooth. Turgor is less than 3 seconds. I'm going to inspect your fingernails. Each one of them, your capillary refills are brisk, less than 3 seconds per fingernail. Your fingernails are clean, your nail beds are pink. I see no signs of clubbing. I don't see any deformities to your chest wall. Absent of pectus excavatum or protruding pectus carnatum. No, there's nothing like that, no deformities. So far, everything looks good. Let me look at your neck. I'm going to look at your trachea. Your trachea looks midline to your neck. I see no deviation. Any difficulty swallowing? No, perfect. Okay, so next I'm going to go ahead and listen. I'm going to start with listening at your trachea, and then I'm going to move to listening in your lung fields. So your trachea, I hear your bronchial sounds at your trachea, and then we'll go ahead and move down to auscultating breath sounds on all your lung fields. So what I'm going to do is ask you to go ahead and breathe every time that I move the diaphragm of my stethoscope. So every time you feel movement, go ahead and take a breath for me. And I'm just going to go through every one of your lung fields. Good. I don't hear any adventitious breath sounds. Your breathing pattern is normal, and you are breathing at 14 breaths a minute, unlabored with no shortness of breath. Great. So everything on the front looks really great. I'm going to go ahead and have you turn around on the exam table, facing the other direction, and we're going to go ahead and move to to your back. So we're going to listen to the breath sounds on your back. I'm going to do a couple of different tests on your back. So if you could just move facing the other direction. Perfect. I'm going to go ahead and first look at your back, and I don't see any lesions. Your respirations again are unlabored. Everything looks good. Your skin color is completely normal for your ethnicity. Skin is intact. I don't see anything alarming. And your respiratory rate is normal. Your anterior to posterior transverse chest wall diameter is at a ratio of 1 to 2, which is completely normal. I don't see any signs of any lung disease. So next I'm going to do a test on you to make sure that your expansion of your chest is symmetrical. So I'm just going to put my hands on the back of your, on your back, and I'm going to have you go ahead and breathe. Inhale and exhale for me. Perfect. And so my thumbs do move apart symmetrically, which means that your lungs feel are filling symmetrically. One lung is not doing more of the work than the other, so that's good. There's no lags noted. And then so we're going to move on to tactile fremitus, which I'm going to go ahead and have you say 99 as I move my hand around your chest. So go ahead and start. Okay, keep going. I'm going to have you do this 8 times. So as I move my hand around, if you could just go ahead and say 99. I'm feeling the vibrations of that. Okay. Great. Okay, so I feel equal vibrations in all of your lung fields, in each one of your lungs. So I note that that's completely normal. And then I'm going to go ahead and feel your chest for any tenderness, lumps, or masses. And everything looks really good. And I'm going to do, when I'm down here, back here by your kidneys, I'm going to tap on my hand and see if you have any tenderness. This is the CVA tenderness test, and we just like to make sure that you don't have any pain at your kidneys. Perfect. Okay, so that looks really good. And I'm also going to go ahead and have you tilt your head forward a little bit, and I'm going to feel the back of your neck and your spine, and then work my way down. Anything painful? Any back pain? Any chronic back pain? No? Perfect. Full range of motion for your spinous processes, evenly spaced, non-tender. Perfect. Okay, that looks really great. So next I'm going to go ahead and do a little percussion on your lung field. So I'm just going to do some tapping just to assess how your lungs sound. I'm going to do that 8 times. So just bear with me. Perfect. So I was able to assess that I hear resonance over all of your lung fields, and so that's a completely normal finding that I'm able to percuss the resonance. So that looks really great. I'm going to go ahead and move on to listening with my stethoscope. So what I'm going to do is I'm going to listen with my diaphragm, and then I'm going to flip that over and listen with my bell. And I'm going to do that in all of those areas. So I'm going to go ahead and start with that back at your back. So you're going to go ahead and just breathe as I move my stethoscope around your lung fields. I'll start up here at your clavicle and work my way down. Okay, so I listen to all of your lung fields, auscultate that there's no rhonchi or rales heard. I don't hear any adventitious breath sounds. All breath sounds sound normal bilaterally in your lungs. So that looks really great. Okay, perfect. And then so we're going to end with I'm going to evaluate 3 different voice sounds. And we're going to start with bronchophony, and that is where I'm going to have you say 99, and I'm going to listen with my stethoscope and listen to make sure that sounds normal, and what normal would be muffled. So go ahead and say 99, and I'm just going to move my stethoscope around your lung fields. Perfect. Okay, so I was able to assess that I heard muffled breath sounds in all of your lung fields, in both of your lungs, completely normal finding. And then we're going to go ahead and move on to egophony, and I'm going to have you say E, and I'm going to listen to those lung fields again. So go ahead and just say E every time I'm moving my stethoscope. And if you want to hold it, then I'll just move it around. But just say E for me. That's great. Perfect. Okay, so I did not hear any abnormal sound from an E to an A. So I was able to determine that that test indicated normalcy in all of your lung fields. And then we're going to finish with the last one, and I'm going to have you whisper as I move the stethoscope around, and you're going to whisper 1, 2, 3 as I move the stethoscope around, and this is the whispered pictoriology. I can't ever say that right. So you're going to say 1, 2, 3, and I'm going to listen in all of your lung fields again. So go ahead and start. It's not an economic disagreement that they have, it's actually a legal disagreement. The ironic thing is... And perfect. So I was able to listen to all of your lung fields. I was able to hear a very, very faint, muffled, whispered sound in all of your lung fields. So that's a completely normal finding. So I'm going to step out, and you can put on your shirt, but real quick I'm just going to go over what I found. And I found everything to be completely normal. I don't see any signs of chronic lung disease. Your skin looked completely normal. Your cap refills looked good. You're well hydrated. No deformities noted in your chest. You have really good symmetrical expansion. I did not feel any unusual vibrations in any of your lung fields. I did not feel any masses. You had no complaints of pain. You had no complaints of pain at your kidney sites with the CVA tenderness. Your spine looks to be normal. You had no complaints of tenderness in your neck and spine. I heard resonance in all of your lung fields, both anteriorly and posteriorly. I was able to auscultate and hear normal breath sounds in all of your lung fields. And I was able to have you successfully pass the voice sounds through those last 3 tests that we were able to do. So today you were completely normal. And if you don't have any questions at all, I'm going to go ahead and wash my hands, and you can put your shirt back on, and then we'll follow up as needed. Thank you.